Good afternoon, everybody. I'm Kelly Johnson. I'm the Ferree Chair of Social Justice at the University of Dayton. And with my colleague, Shelley Inglis, who is the Executive Director of the Human Rights Center at the University of Dayton, I want to welcome you to our ongoing virtual teach-in on COVID-19 and the common good. This is a modest attempt at the University of Dayton to continue the work of the university for the common good. The particular work of a university is to be a place where people think together, where people who have expertise in a variety of fields can work together to build better understanding, better information, to promote better engagement for the good of all of society. Because we're physically separated, it's difficult to do that at this point, to be thinking together. So we've created this format as a way to kind of promote the ongoing conversation among colleagues at the university and with our students across the variety of fields. This teach-in is particularly focused on this extraordinary moment of pandemic as an occasion for reflecting on the common good. In Catholic tradition, the common good refers to the way that the personal good of every person necessarily is connected to the flourishing of everybody, of all people. So those two, rather than being at odds, are seen as necessarily and intrinsically connected. It's a deep and complex and beautiful idea. We're seeing it as particularly important and as particularly challenging under the circumstances of this pandemic. In the first week, we talked about the common good, particularly in terms of political life and public health. In the second week, we looked at the impact of the pandemic on vulnerable populations. And this week, we're turning particularly to look at economic aspects of this crisis, which is an area in which this question of the common good is perhaps more difficult, more challenged, more important than any other at this point. So with no further ado, I'd like to introduce our first speaker today, Dr. Vince Miller, who is the Gudorf Chair in Catholic Theology and Culture and a faculty member in the Department of Religious Studies. Vince.
Thank you, Kelly. I appreciate it. Thank you for having me here, and thank all of you for joining us. It's good to be with you virtually. I'd like to open my comments with a quote from a geographer who was talking about how our anxieties are focused in this coronavirus crisis. And he was focusing in particular on the emphasis on wet markets in China, these places where wildlife is bought and slaughtered on site. He said, why are we so focused on that? And he asked this question that really struck me. He said, what is really putting us at risk? Is it wet markets? Or is it the logistical systems of international trade that stretch all around the world, that connect every city in the world within a matter of hours? Or is it the austerity of our healthcare systems, where we've cut public health and we privatized individual health anxiety, individual health vulnerability? So what really, as we experience this coronavirus pandemic, where does our risk come from? Is it really that there's something happened far away? We're connected to that, but what connects us to it? All these systems of exchange, which is a fact of how our world works today. But what makes us vulnerable here? It's the way our healthcare system is set up to privatize vulnerability and imagine that we can all face this individually. So what I want to do today is, my task is to talk about common good, neoliberalism, and the pandemic. I just want to do three things very quickly. First, I'll discuss neoliberalism and its influence on contemporary policy, how it's remade the world in the past 50 years. I'll contrast that second with the notion of the common good. And third, I'll consider how the shortcomings of neoliberalism are being revealed by the coronavirus pandemic. And as I do that, I'll consider some of the alternative responses we need. I'm going to close, though, by returning to anxiety and the way we're experiencing this pandemic. And I want to think about how, even if we disagree with neoliberalism, we're still experiencing the pandemic from within its structures and the way in which it makes us individuals who face this alone. So I'll end with that focus on how we're experiencing this. So neoliberalism, I want to be clear here that it's a very specific movement. I don't really have time to give a broad history of its existence. It came about in reaction against socialism, and then reaction against especially the kind of combined post-war governments, that the post-war economic consensus that sought to yoke the power of the market to the common good through government guidance, government investment, and regulation. Neoliberalism argued that markets alone were sufficient for human flourishing. And so from the beginning, I want to note that this isn't an argument about whether or not markets are helpful. This isn't about pro or con markets or capitalism. It's an argument about their proper role and limits. What are markets good for? What are they not good for? Where do we need something else? Neoliberals believed that the market sector is always better at discerning and responding to human needs than government bureaucracies are. Why? Neoliberals view the market as a communications network that's constantly and dispassionately processing information through the price signal. So we woke up today with the stock market futures all up because there's a trial of an existing drug, an antiviral drug in Chicago that's looking promising. So something happened. The market's always processing it. And so it imagines that this is the most efficient and rapidly responding way to address any human need. Under its guidance for the past 50 years, governments have systematically dismantled and underfunded social safety systems. They've privatized government functions, and they've reduced regulation on providers of essential services. We're seeing this in Ohio right now. We have a very good government response in Ohio, but one of the things we're seeing as thousands and thousands of people are trying to apply for unemployment, the computer system's overwhelmed. The unemployment office is small, its resources are small, though you can't get through on the phone line. So there's a government benefit there, but the infrastructure has not been taken care of over the past 50 years. It's quite small, and this is true in many, many states. Major nonprofit institutions such as hospitals and universities have been encouraged to adopt market logics as well, to be run very lean and competitively. And so when we have a situation where a crisis comes, there's these enormous institutions that we all rely upon are suddenly quite vulnerable. The big impact of this I want to focus on today, though, is this major policy shift from programs that collectively share risk and focus on social investment. So for example, the kinds of things that my grandfather grew up with, defined benefit pension programs, social security benefits that actually meant something, that were useful for retirement, or as something that, my parents' generation experienced, my parents' generation, when they went to college, publicly funded university education, which was quite reasonable because all of society was investing in that in order to produce the next generation of professionals who could serve society. The shift to what my generation and generations that are in college today experience, we have individual retirement accounts, and higher education is funded through debt. My grandfather was a factory worker. He never made a lot of money. He died with a union pension and union health care and Social Security. He was able to live 25 years and never had to worry about a thing in his retirement. Much better paid people today retire with their personal accounts, and hopefully they've invested enough and invested wisely enough, made the right choices to not run out before they die. If not, well, that's on them. These policy choices form us to think of ourselves in profoundly individual terms. The choices and risks are solely our own, and they're only about us. So you can choose any major you want, as long as that'll pay enough to pay back those loans. Now, society as a whole perhaps needs you to major in something that doesn't pay all that well, but we don't have a way of providing for that, right? People who go to medical school, there are rural counties in this country that desperately need doctors, but they may want to work in a rural hospital, but they come out with loan balances that just don't allow that. They have to work in a big city in order to pay them back. So it focuses everything on individual decision, and it doesn't let us think about collectively what we need as a society. Society as a whole gets reimagined as a collection of market actors who engage each other insofar as it's profitable for each individual, right? And this isn't necessarily selfish. These are just the rules we face, right? The doctor may want to work in a rural county, but they've got $300,000 in loans and they can't do that, right? It has to be profitable. It has to have the cash flow that enables them to keep their debts going. So we have a hard time thinking about how our relationships to others are important. Everything focuses down on our individual choices. This does not mean we don't care. We may well wish others well, but we're not bound together. We're neither obliged nor able to help each other out in significant ways, the way the system sets us up. Now, this view of society is profoundly different from classical, Catholic, and modern notions of the common good. The common good allows a place for individual freedom and for the economic freedoms of the market. But it also holds a special place for collective goods. It names collective goods that we can only achieve together. Dr. Kelly Johnson described the common good well in her session 2 weeks ago. The common good views society not as an assembly of individuals, but as an interdependent community. From birth to death, we rely upon each other and are affected by each other for good and ill. There is no human flourishing to be found in private isolation. So let's move on to the COVID pandemic and think about how this is playing out here. The COVID pandemic is making our interconnection painfully clear to us. One of the most ready-to-hand ways that we experience every day when we get up is our isolation. We feel acutely our need to be together, not simply with our families, if we're living with others in our homes, but with our friends and coworkers, with people on the street and in coffee shops, in clubs and sporting events. People that we barely know, right? That longing we have to be back out with other people and the frustration when we can't do that. In my house, we've had 2 birthdays since the quarantine began, and they're nice. It's nice to have them together, we celebrate together, right? But there's something missing. We can't be with friends. The coronavirus also displays the weakness of neoliberal approaches to governance in a much more systematic way beyond these feelings of isolation. We'll talk a couple ways about how that shows up. It has shown there are things that the market's not good at, namely preparing for rare catastrophic events. There's simply not much profit to be made in preparing for these. Hospitals can't afford to stockpile PPE and ventilators at the level that would be required for a pandemic. They can't really afford to have warehouses full of this stuff that costs a lot of money that isn't making profit for them because of the profit-based model that's being forced into our institutions. And once the pandemic starts, the market price of everything explodes. There's been increases for N95 masks that range as high as 1,000%, right? Something that once cost 50 cents is now going, for enormous sums. The price for ventilators, which are necessary to save people's lives, have exploded as well. But more important than the cost, and this is key here, it's not just about profiteering and people making money. More important than the cost is the unmet need. Factories just aren't prepared to respond to a 17-fold increase in need. That's what we're needing for N95 masks by one account, right? 17 times more are needed now than are normally needed, right? So factories can't simply go into overtime and provide that need. They're run lean. Their profit margins are very narrow. They don't have the extra productive capacity ready to click in for that. It makes no sense for a mask or respirator company to invest in that productive capacity, to be able to surge production for a once-in-a-lifetime event. And setting up new factories takes time. This shows the need for government-run strategic stockpiles of supplies for massive health emergencies. Now, previous administrations had sought to build these stockpiles, anticipating a global flu pandemic, but legislators seeking to show toughness and cutting government waste and enforcing austerity refused to fund them. Right, so this was a neoliberal logic, right? The government's inefficient. The market will handle this when the time comes. Well, the time has come and the market can't handle it. Thinking like an individual doesn't work here more broadly. So we move from providing the medical equipment we need to thinking about how we actually interface with the healthcare system. Thinking like an individual doesn't work here. Even wealthy people with good health insurance face a vastly increased chance of death when the entire healthcare system is overwhelmed. It teaches us painfully that we really can't flourish alone. A society that views healthcare as a private market concern learns quickly that every underinsured, insecure worker is a risk not simply to themselves, but to everyone they interact with. The risks faced by low-income delivery people and store clerks impact the secure customers they serve as much as themselves. Thus, social safety net programs such as a government health insurance policy, government health coverage, or paid sick leave are shown here to be not simply a concern for the unfortunate, those who can't compete for jobs with good benefits. The coronavirus shows that they're essential for everyone, rich and poor, secure and insecure. By helping others, we are more safe. By taking care of others, we live in a safer world. And the same is true on an international level. We're about to watch horrors unfold that will dwarf the sufferings in Italy or New York City when the coronavirus enters poorer nations in the global south. We can imagine that this doesn't affect us as we sit safe in wealthier nations with better healthcare systems. But every country that can't afford to take care of its population will be a living, suffering reservoir for this virus that's always ready to pour out again into the rest of the world. Thus, international health aid programs are not simply a matter of charity that we can ignore in a time of crisis. They're essential to the flourishing of everyone. The coronavirus thus offers a painful lesson on the common good. Everything and everyone is connected. We really can't flourish alone. Our flourishing and suffering are bound together. So we can't take care of ourselves. If we imagine ourselves as individuals cut off from the rest of the world is impinging upon us. If we imagine that their needs are not our needs, we're learning, in fact, that they are. So the pandemic is a great revealer, a great unveiler of what's happening in the world already. It's amplifying all the divisions and vulnerabilities in our society, and they're bouncing back on those of us who thought we were immune from them. We're learning about the common good from the pandemic. I want to conclude by looking at one more dimension of this, though, because we experience the pandemic in a neoliberal world. We're isolated in our single-family homes, in our houses, and our apartments. We're worried about our individual jobs. We're worried about how the economic collapse is going to affect us. And if we lose our job, we're going to lose our healthcare coverage. We're worried about how we're going to pay our individual bills, how we're going to continue to send our children to college. The anxieties of the individualized structures of the neoliberal world are where we live. So as we look out from our single-family homes, the anxieties we feel focus very much on how we can continue to hold this individualized life together. And so that can teach us the wrong lessons, right? That we're on our own and we have to take care of what is ours first, worry about others later. That's a lesson we can learn here. That's the lesson of the structures we dwell in. But there's that bigger lesson hovering out there if we open our eyes, if we let that anxiety be shared with others who are facing the same things, and we can learn that we really are bound together. So instead of learning that we're on our own and must look out only for ourselves, in the midst of this horrible pandemic, we need to really take the effort to work to attend to all its complexity, to learn what it's revealing about our shared life, and find ways to remake the world so we have better ways to act together so we can all flourish together. Thank you.
Thanks, Dr. Miller. For those of you who've been watching, we're able now to bring you into the conversation to talk with Dr. Miller. If you have questions you'd like to bring to him, please send a message to Shelley Ingalls in your chat, and she will let you know that you can get into the conversation. We can unmute you and bring you into chat. While people are thinking about questions they may want to ask Vince, I can tell you there was one question that came to me in chat. I don't think he's going to be able to join us to ask, but a person who is raising the question, how do you pay for all of this? And I think what's behind that is that for all that we can say, yes, we are interconnected. um, there are people who are going to be asked to bear costs for things that don't have an immediate effect on them. And that really closes off life possibilities for people. So how do we think about paying for healthcare, for example, for impoverished countries, when that does in fact mean loss of opportunity, loss of benefits for people here without any obvious connection they're going to be able to see?
That's a great question. Well, I'd say first, I think we're seeing how much it costs to not make those payments up front, right? So the pandemic task force, the World Health Pandemic Task Force that we have, are not terribly expensive. We just a handful of years ago, we spent millions and millions of dollars in Central Africa to end the I'm sorry, I'm forgetting the previous infectious disease.
Ebola.
Sorry. Those aren't terribly expensive, right? They're on the order of hundreds of millions. To deal with the global coronavirus pandemic, that's going to cost a lot more. But we're never really going to solve it here until we. But thank you, Shelley. Ebola, yeah, that's it. We're never really going to solve it here, and until we help other countries solve it there as well. We may come up with a vaccine, but if coronavirus continues to mutate as viruses do, it's going to keep coming back, right? And so we are all stuck in this together. The other thing in terms of costs, it was about $800 million to build up the stockpiles that they wanted for pandemic flu, and that was cut from the budget because of austerity, right? We need to reel in government spending. Well, we're spending a lot more than that right now to try to buy this in the midst of a crisis. When it comes to public health care, we in our privatized, fragmented healthcare system in the United States, which is based on employment and a patchwork of government subsidies and government programs, we still pay the highest per capita on healthcare, one of the highest per capita rates on healthcare in the world, right? It's not like the particular current system is particularly cheap, and more socialized systems are more expensive. These collective systems are often cheaper. So we're going to pay one way or the other. So in terms of that question, I think we have to look at just the enormous costs we're paying right now, and throw that into the backward equation when we evaluate what's the cheapest thing to do in terms of setting up our economy, in terms of setting up our safety net.
Thanks. So we do have another question now, I think, from Chuck Watts.
Oh, thank you, Kelly. Is there a reason, Dr. Miller, that you prefer the term of neoliberalism versus extreme conservatism? And the reason I ask that the use of the term neoliberalism seems to make the ignoring of the common good the fault of liberalism or progressivism, which has core values of empathy for and responsibility to others. I was just wondering why you prefer that neoliberalism versus the other extreme conservatism.
Yeah, I mean, it names a particular movement of people, a particular movement of Austrian economists who in the 1950s came up with the word neoliberalism to describe their particular economic school of thought. They named it neoliberalism to say that it wasn't classical liberalism in the sense of laissez-faire, of letting the market work. Neoliberalism sought to make market structures the norm of governance throughout society. And so neoliberalism was proposing that markets are the most efficient way to make decisions, and you should actually, they should be the way that you structure society. In fact, you should, in many cases, force them into society. So it was an activist understanding of using markets to solve all human problems, and that's the name they chose. They eventually got rid of that name. They stopped using it sometime in the 80s. In the United States, we tend to call those people call themselves conservatives. It's it is a radical form of classical economic liberalism. So our labels just get a little messed up as we move from Europe to the United States. Yes, but yeah, neoliberalism in the United States is generally the position of people who call themselves conservatives. I don't really know how to square that circle, but that's it's purely a question of labels and what they call themselves. Yeah.
Thank you.
In the rest of the world, like these would be called the liberal parties, right? Which is not what a liberal is in the United States. So.
I think Shelley has a question. Shelley, would you like to join in?
Thank you, Dr. Miller. That was a really excellent presentation. In terms of costs, as following up on Dr. Johnson's question, the government of the United States passed a couple of weeks ago an immense CARES Act, the largest federal distribution of dollars that I think we've seen perhaps ever, even taking into account the Depression and the post-World War II order. So the money that was there to be mobilized and has been mobilized, and this is thought of to be one of multiple congressional acts that we'll see in response to this crisis, demonstrates the depth of what it means to live in the richest country in the world, and the United States continues to be the richest country in the world. In terms of the relative costs of contributing to healthcare systems in developing countries, for example, or other costs that would be involved in having a more proactive approach to prevention, do you know of analysis that actually looks at whether that would really involve more shifting of priorities and approaches, or whether it would involve really greater costs to people across the United States in terms of taxation? Have you seen conversations about people understanding better what the true costs are, or whether this is a matter of seeing things differently and allocating resources differently?
Yeah, I think it's worth this adding up quickly, the costs of what we've currently done, right? So the CARES Acts were what, around 2 trillion. The Fed is doing quantitative easing to the tune of 6 trillion, right? These are truly astronomical amounts of money. But let's just stay with the CARES Act, which I think was 1.8 trillion. So about 2 trillion. That's deficit spending. That's going on younger people today's future. They're going to have to pay that back tax-wise, right? That's how we're funding on that. I think the best contrast is to make is with South Korea, which has a very robust public health care system. And so they had their first infection on the first detected infection on the same day we did. They had a robust public health system that could ramp up testing and do contact tracing, and they shut the epidemic down, right, within a matter of weeks. That would cost billions and billions of dollars in the United States to do that, right? That's pennies on the dollar to what we're paying because we couldn't do that, right? We simply did not have that capability. We're talking now about reopening the economy, ending social distancing so we can reopen the economy. That probably from a healthcare perspective is not going to work. We're going to have to close down again. We're going to have additional bailouts, right? Public healthcare systems, a robust federally funded, state enacted public health system would have been expensive, right? It would have been billions of dollars. It would have not been trillions of dollars. It would have not been 1 trillion. It would have not been 9 trillion, right? It would be billions of dollars a year. And that's small change given the size of the federal budget. So pennies on the dollar had we taken care of this before. That's the lesson we learned, right?
Thank you, Dr. Miller. This was a really great session. We're going to pause now just for a short break. If you need to get up and stretch your legs, this is a good moment to do it. And we'll be back in just a minute or two with Dr. Caroline Waldron, who will be talking about workers' rights. Thank you.
to start my video. Can you hear me?
Yes, there you are.
Oh, okay. But why? It's weird. Okay, sorry. Oh, there I am. Okay.
Yes.
So, and then, so I'm going to share my screen.
Okay. And let's, before we restart the recording, let's be sure that you can advance your slides.
Oh, okay.
That should work. Switch to Okay, let's see, here we are. Good, so let's go ahead and get started. You all right with that?
Yeah, actually, Kelly, I have one. So I'm going to read. Yeah.
Okay, we're back now for our second presentation in today's virtual teach-in. We have Dr. Caroline Waldron, who is a professor in the history department here at the University of Dayton, who specializes in, among other things, labor history. She had a postdoc at Cornell's School of Labor and Industrial Relations. And we're very lucky to have her here with us today to talk about insights from labor history about workers' rights. So Dr. Waldron, over to you.
Thank you, Dr. Johnson, and thank you everyone who is participating. I'm really glad to be a part of this, and thanks to Shelley Inglis as well for co-sponsoring the teach-in. So what I wanted to do today is put the COVID-19 crisis that we're all experiencing into the context of labor history, but specifically a context that has to do with health and safety on the job. And I was glad to have the opportunity to think about this, because I think that a lot of historians are making connections between labor and specifically COVID-19 and the other pandemic that the United States and the world really faced in 1918 and 1919, which was the flu pandemic of those years. And I think Ashley Lawrence Sanders, my colleague in history, actually mentioned those, and that it's an important connection. But I think for labor history, perhaps the better connection is to think about this cataclysmic moment as being akin to the Great Depression. It's one of the worst economic disasters the world has seen. And also in terms of workers' rights, the trajectory of specifically health and safety. And so that's what really I'm going to focus on today. I want to remark on the statistic that I heard this morning that 4,491 US residents died in the past 24 hours. That is double of the day before. And it is the US now surpasses any other country with that statistic. We have 4% of the population of the world and 20% of the deaths now. And so then the question becomes, who is most affected by this pandemic? And I think that Vince and others have talked about this in the other sessions, but it's really workers. And who are those workers? They're healthcare workers, they're doctors, they're nurses, they're aides and technicians, janitorial staff, cleaning crews. They are drivers, transportation workers, ambulance workers. There are people who work in hospitals, nursing care facilities, as well as home to take care of the sick and the elderly. We also have among frontline workers who are really facing these hazardous conditions, and perhaps while it doesn't seem like a luxury for us to stay at home, it is, because there are frontline workers, farm laborers, again, delivery and transportation workers, gig economy employees, as well as workers for Amazon, UPS, United States Post Office, as well as Uber, and that are risking their lives for us every day. There are grocery store clerks, and there are men and women who are working in warehouses, again, at UPS, in the USPS, as well as at Amazon. And they are responsible for keeping those supply chains going. We also, in this pandemic, and I think that it's the marker of a meaningful historic moment, is that the lexicon of new words are coming to us as we move through the weeks, although they seem like years of the past few months. We now talk about essential workers. Those essential workers, it's interesting to think about for a historian. They map on very nicely to what the Knights of Labor, which is a 19th century labor organization, one of the first in the United States to organize. The Knights of Labor organized what they called producers, and forgot and basically did away, or wanted to do away with, the groups that they called non-producers. But the essential workers that we talk about today in this crisis actually map on quite well to those Knights of Labor producers. The one exception is bankers, and bankers were considered as non-producers in the 19th century Knights of Labor lexicon. But as I know, I recently sold a house that the mortgage companies and the bankers and the lenders were open for business. But on these front lines, we also not only learn about essential workers, and that lexicon and of what those groups are comes into our everyday language, but also the acronym PPE, the personal protective equipment. And so essential workers have been demanding PPEs, and non-essential workers, those workers that, for example, GE factory laborers are offering to help provide PPEs for essential workers to transform factories in this country that might have produced airplanes and cars and other industrial equipment into PPE factories. And that is an act of what we call solidarity, working class solidarity. And it's an innovation that comes from the bottom rather than the top. We haven't seen too much of that, although there are connections now being made between Ford, GE, and hospitals. What we are witnessing in all of this, and in the crisis, and particularly as it has to do with the essential workforce, is issues of health and safety on the job. And health and safety on the job actually has a, oops, I just moved my slide, sorry. Health and safety on the job is part of American labor history. And it's represents, I would say, over a century of struggle. Since the 19th century, workers have been organizing to improve workplace health and safety and conditions on the job that were impacted by the Industrial Revolution. Coal miners were among the first to begin these organizing drives for safer working conditions. Those organizing drives started in the 1830s when a Scottish doctor actually identified the phenomenon of black lung. And black lung is caused by the continuous inhalation of coal dust that miners had to experience. And black lung is basically a scarring of the lungs, which causes something called coal miners pneumonia or coal workers pneumonia. It took, again, over a century for any legislation to be passed that protected American workers in terms of, and coal miners in particular, in terms of black lung. You had, again, organizing drives from Pennsylvania, Ohio, West Virginia, miners across the United States, fighting for legislation, fighting for better working conditions in terms of environmental hazards and dangerous things that they would find in the mines, including fires, floods, chemical exposure, the risk of having the walls collapse in on you, as well as the issue of black lung. So it was 1969, actually, that the United States government passed the Coal Mines Health and Safety Act. It was put into law, and it protected coal miners by creating minimum safety standards, and particularly important for coal miners, providing compensation for miners that were disabled on the job. The Coal Mine Safety Act in 1969 really led the way to one of the most important pieces of labor legislation in the country. The Occupational Health and Safety Act in 1970 was passed, and the verbiage of that legislation, the OSHA legislation, is on the slide, but it was an incredibly important piece of legislation because it basically deemed employers responsible for furnishing a healthful and safe working environment that was free from recognized hazards, as well as sort of those that caused death or serious physical harm to employees. So the Occupational Health and Safety Act created the Occupational Health and Safety Administration, which is housed under the Department of Labor. Since its passage in 1970, there have been continuous attempts to undermine its power, or as well as its funding. But workers see this as such an important piece of legislation because it really has provided the possibility of, again, having healthy and safe lives. And one of the things that we've seen over the past 50 years is that while employers are responsible for furnishing safe and healthful working places and conditions for their workers, it really falls on workers themselves to put into place or to educate themselves what hazardous conditions are and take steps to mitigate them. And this should sort of put all sorts of bells in your head about, this is exactly what we're experiencing and witnessing now with Amazon workers, walking out with Instacart workers, demanding better and safer working conditions, et cetera, and I'll get to that in a moment. But 2 years after the OSHA legislation was passed, the president of the United Electrical Workers Union, Ernest DeMaio, actually spoke at a conference of the medical committee on human rights, and that committee was made up of doctors and nurses at the time. And so I wanted to play you just a little clip because it's sort of this historic moment. It's one of the first moments where doctors and the medical community were coming together with union activists. So again, we see a little bit of a transition. So we'll see if I can get this here. It might not work. It might just be too slow for us. Sorry, I thought this would work. Okay, well, there's the link in my slide for anyone who's interested in watching the whole 26-minute speech. I was only going to actually put on, I just don't want it to start playing if I'm going back to my slides. If anyone's interested in watching it, DeMaio speaks about the importance of basically workers making sure that employers actually follow the law. The other thing that is nice about this little clip is that he mentions going into the Delco factories in Dayton, Ohio. Again, the conference he's at is in Chicago, and so it sort of it threw me for a loop when I first watched it. And but we'll skip that for now. But as I mentioned, this connection between workers and doctors was incredibly important and represented a type of transition in American history. And this, so I'm going to transition a little bit here, but so whereas in European countries, starting in the beginning of the 20th century, there was really a strong connections between the medical community and the industrial community, and the development of something called industrial medicine, which was in part preventive medicine to basically keep workers safe and healthy. There was nothing like that in the United States. In fact, Alice Hamilton, who's pictured here, she's one of the first female MDs in the United States. She really lamented the fact, and she spent her life, Alice Hamilton spent her life really trying to work for public health and what, we're the common good, if you will, because she did see the importance of protecting workers through the medical community, but having sort of three parties talk to one another about health and safety standards. Hamilton was a pioneer. She was able to get some occupational legislation in Illinois, where she did most of her work in 1909. The sign that's on the slide is one of the results of that. And you'll see it's in various languages, this sign about danger, about the blast furnace. That's because there were a number of different immigrant groups working in factories in the United States at the turn of the century. So much of the signage went up was in multiple languages. We take a little bit of a jump and through to the Social Security Act and administration. That's really the first piece of national legislation that takes into consideration and puts at the forefront, again, health and safety of workers. That Social Security Act, the thing that it does, and many of you know your Social Security sort of funding at retirement, but the Social Security Act also funded in the 1930s health personnel, and that health personnel would the part of the training of the health personnel would be to go into industries and to basically again sort of provide investigation that would result in healthier and safer workplaces. We see sort of the progress of this through World War II in terms of the way that the federal government provided oversight for war plants and munitions manufacturing. Then in the 1950s, there is sort of a falling off of these connections between, even if they were tenuous, between labor, the notion of public health, and industrial medicine. And there's, I think part of it has to do with the American Medical Association's real fear of basically national health care. So one of the things that's happening in the 50s is the federal government allows for health care to be part of sort of collective bargaining discussions. And so that is an important way that private healthcare becomes entrenched in the system in the United States. And again, I think, on one level, if unions are strong, if the economy is strong, and you have industry providing healthcare, it works. But as we are seeing today, and I think as many people are very fearful of, losing a job means losing healthcare in a pandemic, and that is a recipe for disaster if we already haven't gotten there. So, but this sort of the relationship between sort of the health insurance, collective bargaining, as well as the role that workers play in terms of protecting themselves on the job, is exactly where we are today. I actually attended a webinar that was put on through Georgetown, and it had a number of labor activists there, and there was a representative of the AFL-CIO who was part of the panel discussion, Kathy Feingold, and her statement that this pandemic is all about labor, I think makes a lot of sense. It's all about labor because basically it's labor that's keeping us alive. And as we, in many ways, so as I mentioned in the beginning of the talk, what we see is that there are groups of workers impacted in different ways. And this includes, the doctors and the nurses and the technicians that are in the hospitals themselves, the care workers who are risking their lives every day without the proper protective equipment, to the drivers who are delivering for Amazon and Instacart. And we're seeing at this moment, it really how clearly it is that the employees are responsible for the safety and health of their own workplace. That despite the fact that we have legislation like OSHA the employers are following, if you will, and with a lot of struggle, the lead of their employees. And so I have this picture, you know, of Amazon, the familiar website that now has that banner across the top that is, we are giving priority to essential items. Well, Amazon is giving priority to essential items because workers demanded that they did. In the past week, at least 5 Amazon workers that I can count have lost their jobs because of speaking up against unsafe and unhealthy working conditions. Those are both warehouse workers and workers, sort of tech workers. 2 tech workers were fired by Amazon for tweeting messages that basically asked for matching funds to help the warehouse workers. And so this is dangerous business in terms of organizing for health and safety in one's workplace. But workers are still doing it. And so again, we see Amazon workers, we see Instacart workers, we see nurses and doctors walking off their jobs, basically making the public, making us aware of unsafe conditions, but also asking us as consumers to be part of the solution, to request that safer conditions be provided. And then just in terms of a couple of things. One, it's not only essential workers who are demanding things. What we see is even the non-essential workers are actually are demanding things that have an impact on everyday life. So the union that represents Disney workers, for example, in Orlando, got 40,000 extended contracts for workers on the job as Disney is shutting down. We also know that the CARES Act, with which Shelley mentioned, is helping both essential and non-essential workers. That act was put into place with bottom-up challenges from workers, from an everyday folks that again, provides an enormous package for the 6.6 million people in the United States who have in the past month applied for unemployment. So I will end there because I see Kelly has come on again and would love to hear people's questions and continue the discussion, as well as hear Dr. Sayre who's next up. So thank you very much. And yeah, let me know if you have any questions.
Thanks, Caroline. I think Molly Sayre had a question she wanted to ask you. Molly, are you there?
Oh yeah, okay, so I see you, Molly. Okay.
I see you too. It's good to see you.
Yes, it's nice to see you.
Caroline, I want to go back to where you started with a definition of frontline, in quotes, frontline workers.
Yes.
I've just been observing an interesting use of that term where when people say it, I appreciated your expansive definition. You included so many groups of workers in that, but when I hear it in more common parlance, it seems like it almost exclusively includes professionals and often is limited to professions that are male dominated. And so every time I hear frontline, I keep waiting for nursing home employees to make it into someone's phrase where they describe what they mean by frontline, and it just rarely comes. And so I'm wondering, my question is, what are implications of this term frontline when we neglect so many groups of workers and limit it to doctors and nurses?
Yeah, I mean, I think it's classic, right? In the sense that you know, we tend to see middle and upper class professionals rather than working class folk, and so I mean, I think we could even talk about the difference between you know, the term essential workers and frontline workers. I think my slide there, you know, you can find many images on the web, but there are images of these Amazon warehouse workers saying we are essential workers too, right? Or farm laborers saying we are essential laborers or frontline laborers too. I think again, it's just, you know, we must insist on this. I actually, you know, on Facebook, one of the friends that I have who's an MD sent around an interesting note that it was just like, here are the people that work in the hospital, like just like listing, like, you know, everybody, here's what people think, doctors and nurses, but all the, you know, the long lines of people who are, you know, really on the front lines, you know, to sort of face this disaster in ways that for me, I mean, I see the pictures, but I can't, it's really hard to fathom. So yeah, there are a lot of people who are feeding us and making us safe as we sit at home and maybe get tired of our families and, you know, or yeah, but so, but I appreciate the question, yeah.
Thank you, Dr. Waldron. We're gonna take a quick break and
okay, yeah,
as we get ready for our next speaker. This was great. We really appreciate your contribution. Next up is going to be Dr. Jamie Small. We'll be talking about the disproportionate effect of this economic challenge on women. So stretch your legs and we'll be back in just a minute with Dr. Small. Presentation in our virtual teach-in today. And next up we have Dr. Jamie Small, who is faculty in the Department of Sociology, Anthropology, and Social Work at UD. She has a background in sociology and in women's studies. And so we're very eager to hear from her. Thank you. Take it away, Dr. Jamie Small.
Thanks so much, Kelly, and to Shelley as well for inviting me to do this. Like Kelly said, I'm a sociologist here at UD, and my research focuses on law, crime, and gender with a specific focus on masculinities and sexual violence. And so I'm going to be talking in the next couple minutes about the gendered impacts and ideologies and dynamics of the COVID-19 pandemic. And so I want to think about it in different ways, but the broad framing that I'm going to be working with is gendering the crisis. And when sociologists and feminists talk about gender, we talk about it at different levels of analysis. So anything from the individual level, self-presentation, social identity, thinking about gender, all the way up to the structural level, the ways that individual humans are organized and situated in relation to communities, societies, the public sphere, the private sphere, in different ways that oftentimes follow historical patterns of where the private domestic sphere was associated with women and femininities, and the public political sphere was often associated with men and masculinities. And also, when we think about gender and gendering, which is a term that sociologists use quite a bit, there's two different main ways you want to think about it. The first would be to think about the ways that people experience any given human social event, process, outcome in different ways, perhaps according to gender. So we're acutely aware of the ways that men, women, genderqueer people, transgender folks might experience or have different outcomes on any given metric. So we're looking for both patterns and similarities. It also means when we're thinking about how something is gendered, to say like gendering the crisis, is to think about the ways that ideologies of masculinity and femininity might become further entrenched or drawn upon in order to explain the crisis. One example of this that comes to mind is thinking about the ways that hyper-masculine, hyper-macho form of political showmanship becomes even more entrenched in this particular moment. But we're also seeing the limitations of that, not only in terms of policy and practice, but also it just isn't quite effective. So I'm going to jump to my slides. And let's see. Okay, I think you all should be able to see the whole slideshow now. So I want to start with a clip that went viral 3 years ago now, so in March of 2017. And this was a clip that really highlights, in a rather humorous way, the collapsing walls or doors, as it were, in this particular case, between work and home. So we know in a 21st century world that the divisions between work and home have become a little bit frayed, but not to the same extent as what we're seeing in this crisis. So this clip obviously preceded the COVID-19 pandemic by quite a long stretch, 3 years ago now, but this was what has now become affectionately known as the BBC Dad. And this was Professor Robert Kelly, who is a professor of political science. He was giving a video interview with BBC about very important political issues going on in South Korea. And as you can see, he was doing it from his home office. And I'm going to switch over to YouTube, cross our fingers that the technology works. And so the clip's just under a minute, and we can see what happens in this classic case of the lines between work and home fraying.
And what will it mean for the wider region? I think one of your children's just walked in. I mean, shifting sands in the region. Do you think relations with the North may change?
I would be surprised if they do. Pardon me. My apologies.
What's this going to mean for the region?
My apologies. South Korea's policy choices on North Korea have been severely limited in the last 6 months to a year. Scandals happen all.
Okay, so as we see in that clip, there's this sharp intersection between work and home when Professor Kelly's two children, Marian and James, come bursting into his home office, followed by his wife in a moment of panic, trying to collect them. And everyone's trying to maintain the decorum of a very serious professional interview, but it's difficult to do. And now in the last month that we've all had to ramp up remote working at a rapid pace, we've all learned how to do this. My daughter's upstairs right now, and she's been instructed to not come downstairs unless she starts vomiting or a cat is on fire. So we're all having to navigate what happens when those lines between work and home collapse. So some of the guiding questions I want to walk you through is what happens in families when everyone stays home? And what about the people who can't stay at home? So we're now, many communities around the world are living under stay-at-home government mandates. And in some ways, as a sociologist, we're always looking at times of great transformation, whether they are slow moving or unexpected, as an interesting case study. So we can think of this in a sense as a great social experiment, although of course, since we're already living through it, it's probably not a spoiler alert to anyone to know that this the outcomes might not be so great. We already know that in many ways this isn't. But essentially, we want to think about when we have this massive disruption to everyday life, the split between the public and private worlds collapses. How do people navigate that? And how does gender emerge as a guiding way that people deal with this, both in terms of differential impact across groups, and then also the ways that people might move toward thinking about gendered ideologies of making sense of the world. So I'm going to highlight a couple cases in this brief presentation, but these empirical cases I'm talking about are by no means exhaustive. So I'm happy to do follow-up conversations or questions on email afterwards as well. Okay, so the first thing I want to highlight is that we are now living in this space where we have a hyper-amplified second shift. So the second shift is a term coined by sociologist Arlie Hochschild in the 1980s. And what she was studying was when women enter the paid labor force at rates, unprecedented rates, and were graduating from college in much higher rates than they had done in the past, what happens to all that unpaid care work or reproductive labor that women had historically done for free? Does the distribution of labor and chores in households, does that change at all? Does it stay the same? And it turns out that Hochschild's findings in the 80s, and to some degree, a lot of follow-up research has suggested that things haven't changed tremendously since then, is that women end up doing all that unpaid care work. And so what we have now is with school closures and the increased needs of older people, especially in households that have school-aged children, we have an exponentially increased demand for this work. So one of our questions is who will be doing that? And these are questions we can't answer quite yet. It will take some social science research and reflective pieces looking back at this time to see if the patterns become further entrenched or if there's new ways that families navigate these issues. We do know that fathers in heterosexual relationships in this current generation do more hours of childcare per week than their fathers and their grandfathers had done. So the split between how many hours per week women do on childcare and how many hours fathers do has been converging, but we know that women still do more hours per week on childcare than fathers. And then for other kinds of reproductive labor, the less exciting things, like cleaning, cooking, all that administrative load of managing a household, women still tend to do more of those. So it will be really interesting to see how families navigate these issues, particularly, again, those with school-aged children and managing remote work schedules, managing the taking full responsibility for children's education. Our teachers are doing amazing work, but when children are in households all day long, much more of that responsibility falls on parents. Now, second, the other thing that happens when families are at home, they're not only having to navigate remote work or moving out into the public sphere to complete their jobs or navigating unemployment, but we also know that homes are not safe spaces for everyone. We tend to have a romanticized idea of home and domesticity as this great place of emotional connection and where everyone's happy and sitting by the fire. But it turns out that homes are not safe spaces for many people, particularly for many women and children. And so when people are confined in homes, which are relatively small spaces, and they're having the additional stresses of dealing with mass unemployment, food insecurity, isolation at unprecedented levels, Zoom calls are not the same as seeing people in person, illness, all of these factors are great stressors on already burdened families. And these stressors increase the prevalence of domestic violence and child abuse. And sometimes we'll see this in relationships that had not been previously violent. We also know that relationships that were violent prior to the pandemic, these unprecedented social conditions and constraints just amplify the stressors that lead to violence in the first place. And I'll note too that when we're talking about domestic violence or intimate partner violence, which is another common term used, that it's not just physical violence. So this is a misconception a lot of folks have, but abusive relationships can be characterized by other forms of controlling behavior as well, such as forced isolation from friends and family, constant surveillance, strict rules and codes of behavior that the victim must follow, and even micromanaging little everyday aspects of life like access to food and bathroom facilities, these kinds of things. So we would be insufficient from an empirical standpoint if we didn't recognize that domestic violence is often about a lot more than just physical violence. And so what we're seeing is an increase in both frequency and severity of violence in the home against both women and children during times of crisis. And we're starting to see anecdotal evidence really from the past month or two from other countries that are a little bit further along in their pandemic trajectory that violence has definitely increased. And the mechanisms for this are multiple in terms of how we make sense of this. Like I said, it's about the constraints that people are experiencing that create stressors, and then people lash out in violent ways. But also it's that victims don't have the relief mechanisms that they would have under the ordinary normal conditions of life. They're not going to work, they're not going to school, they're not able to see friends and family at the same rate. And so they just don't have that same sort of relief from an abusive situation. Same with abusers. They are in constrained situations and things, the everyday aspects of life that might help to relieve some of the stress that can lead to violence. People just don't have access to that right now. And so one of the things that we're seeing, the best metrics to track increased rates of domestic violence right now are calls made by victims to hotlines or police, law enforcement. And it looks like in a lot of jurisdictions, numbers are starting to be reported that there's been an increase both in the US and in various European countries by about 20%. Not all jurisdictions are seeing this, but that's where we're at right now. And of course, the calls to authorities or to domestic violence hotlines are an imperfect measurement. They can't get a full assessment of exactly what's going on. So it's probably going to take us about somewhere between 12 to 24 months to understand the full impact, to understand how these months and weeks that we're under quarantine compare to other similar times, and when we start to get anecdotal evidence from folks who are living in these situations. I think that, for women in abusive situations, the dynamics are really horrific. For children too, especially because they're especially vulnerable, don't have access to teachers and other trusted caregivers in their lives that might be able to provide that support for them. And they, particularly young children, are quite vulnerable in the sense that they might not have phones or access to the internet or any connection to the outside world. So this is a huge issue when we have a public health response that focuses on primarily on the physiological, the biological, the viral aspects, but doesn't take the social or economic dimensions in a full, robust way. It becomes a problem because it can't account for these collateral consequences, the collateral damage of having folks stay at home without really having great exit options, especially in times of acute crisis. Not having a shelter to go to, and some domestic violence shelters are remaining open, some have closed or beds are full. So in Spain, some jurisdictions were opening hotel rooms for victims to go to, but it's a tricky hot mess in terms of what happens in family spaces and homes that aren't safe. So I'll show you that you might not be able to see all the text on this infographic perfectly. If you're interested in it, you could go to the original website on unwomen.org, but it provides a lot of great information about violence against women and girls in general and some of our baseline measures that we have around the world. If you look in the lower left-hand corner, it also shows some of the increased rates of calls to hotlines that we've seen in different countries like France, Argentina, in North America, and in Singapore and Cyprus. So again, we have reason to believe, given our historical understandings of violence against women and girls, as well as some of the early data that's coming out in anecdotal data, that we will expect to see these rates only continue to rise. And one of the best things that people can do for people who might be supporting someone in these kind of circumstances is to meet them where they are and recognize that these are tight circumstances. And under the very best of circumstances, it takes women oftentimes a long time to leave an abusive situation. And obviously now the exit pathways are substantially decreased. The other thing I wanted to talk about, the third and last empirical case I'll touch on today, is what about, as we look outside the home, what about workers who can't stay at home? So building off of Caroline's earlier commentary on labor, workers' rights, and a lot of our essential workers, so this is kind of a newish term that is now bandied about quite a bit, it are in industries that are disproportionately represent women. So things like healthcare, retail, food service, 91% of US nurses are women, 72% of US cashiers are women. And especially those at the lower end of the wage spectrum might be in a position where they're still needing the paycheck, but the paycheck is going to be woefully insufficient given the risks that they're incurring on the job. And we know that occupational segregation, especially in the US, means that women are disproportionately represented in both the informal economy and in low-wage sectors that offer few, if any, benefits at all. And obviously right now, one of the huge benefits that's missing for so many workers in the US is healthcare. Not having access to good medical treatment right now is just a huge loss for so many people. And then we know that economic vulnerabilities that we're seeing are even more acute for women of color, undocumented migrants, and single moms. And if we tie it back to thinking about what's going on the home front, having children, having women who have to go out and continue their job outside the home when daycare options have been decreased, and even informal networks for babysitters, like with family or friends, might not be a great option anymore. Okay, so I want to close with this quote that circulated quite a bit from Dr. Anthony Fauci. And he spoke this about a week ago. He was talking about the disproportionate impact on African-American communities in the US. And he famously was talking about shining the ways that the coronavirus and its impact shine a bright light on some of the real weaknesses and foibles in our society. And I think we can say the same for the ways that that impacts women and girls, that women and girls are structurally located as a group in a way that their vulnerabilities will make them feel the impact of the COVID-19 long beyond once the virus is under control by public health scholars. And one thing to note is that it looks like data show that the mortality rate for men is higher, but we can likely predict that the long-term social and economic consequences for women and girls is going to reverberate for many months and years to come. And I'll close on perhaps just a slightly more positive note to think about the ways that some of the lessons we're learning, some of the pitfalls that perhaps should have been obvious to us for a long time, but for given the structure of our society, we're not, that to take this time to think about the policies and practices and daily rhythms that we might want to take with us moving forward. And this last slide I have is just some additional resources, some spaces that are publishing some really great work, both scholarly and journalistic pieces on the virus and its intersection with gender. So I'll wrap up there.
Thanks, Jamie. This was, I know if you all have questions you would like to ask Dr. Small, we have a section where we could take questions. I'm going to go ahead and raise one to get us started. One of the things that struck me as I listened to you was that it seems like there are some areas where we have made progress in addressing this, and other areas where we have not. Maybe no place where we've made enough progress, but some places where. What do you make of what do you make of that difference? Why are some areas more difficult? Why is it more difficult in some respects to move the bar than in others?
Yeah, in what examples were you thinking of?
So I guess I was thinking about, there is some evidence that at home, to a certain extent, men are carrying something more of the load. But in terms of which workers are in the most dangerous positions and are most likely to be affected by the downturn, we're not seeing as much of a change.
Yeah, and I mean, I think that this goes back to thinking that gender and women it's not a unified category. This is where our intersectional lens can become really important to think about how women are situated differently according to social class, according to race, and a number of other identity factors. And it actually made it a little bit hard to put this piece together, because I think that the experience that of professional workers who can just ship their work home, as stressful as that might be, it's a very different experience than someone who's working a minimum wage job and being exposed to the virus. So I think, on a regular basis. So I think that that's part of the answer, that women are situated very differently. And so it's really important to have that gendered analysis and think about women as a group, but it's also woefully insufficient for understanding the myriad experiences.
Okay. Thank you. This has been a really great presentation. We're going to have to wrap it up there because we've got somebody else coming up next, but thank you so much for helping us to understand this dimension of the crisis, to think through gendering the economics of pandemic.
Thanks so much, Kelly.
Everybody, we're going to do a kind of a quick changeover. Next up is Tony Talbot, who will be talking with us further about a particular kind of challenge to economics and labor during this period. So back in just a minute. Thanks, Jamie.
Hi, can you hear me?
I can. There you are. Perfect.
Great.
Do you need anything? You got slides you want to test out or anything before we?
Yeah, let me test it.
So I can be sure I can see the next one.
Oops, hang on a second.
We had somebody who could only ever show us. Yep, perfect. That works great.
Okay, and I was going to start out on me, go to the slides, and then end on me again.
Okay.
So I'll share and stop sharing.
Okay, looks good. Looks good.
Excellent.
All right, ready to go.
Cool.
Virtual teach-in on COVID-19 and the common good. And we have with us now Tony Talbot, who is the Director of Advocacy for the Human Rights Center here at the University of Dayton, and also the Director of Abolition Ohio. So Tony, take it away.
Thanks, Kelly. Hi, everyone. And thanks to Kelly, Shelley, and everyone else for putting this whole thing together. I think it's been wonderful. And I was really happy listening to the previous presentations today, how this, I think mine is going to be building on and feeding into those and building onto those quite a bit. I want to talk a little bit about human trafficking in the pandemic, and seeing human trafficking is just sort of a one type of case, one type of human rights abuse that is potentially that always exists, but is potentially being made a lot worse by the conditions of COVID. Excellent. So basically, I want to really briefly give an overview of human trafficking, talk about some different aspects, sex and labor trafficking, consider the fact that human trafficking is a commercial crime. It's a business, and it's all about human beings exploiting their fellow human beings for profit. And then really focus in on COVID-19 and some push factors and risk factors that are impacting human trafficking. I am the Director of Advocacy, and I am an advocate as well as an academic on this issue. I want to close with a couple of quick slides just showing how folks can get involved and do something about trafficking. So basically, let me move this. I think a good plain language definition of human trafficking is just when people are forced to work for little or no pay and they're unable or unwilling to leave that situation. It is done for another person's profit. It is, some folks call human trafficking modern day slavery because it is the illicit buying and selling of human beings or the buying and selling of human labor. It's a very dehumanizing practice. The victims are treated in many cases like animals or machines and are physically, emotionally, spiritually abused. And there's different ways to look at the issue, different frames or lenses we can bring to it. We can see it as a violation of fundamental human rights, as a form of crime against individuals, as a form of gender-based violence or violence against women, since the majority of victims are female. And of course, it's also a public health issue and a public health crisis, which is really coming to the forefront now during this pandemic. A little bit more specifically, legal definition of human trafficking. This great chart just shows action, means, and purpose. In 2000, the U.S. Government passed the Trafficking Victims Protection Act, which is the U.S. federal law against human trafficking. Less than a month later, the United Nations Palermo Protocol was passed, which is essentially the international law dealing with human trafficking. And under the U.S. federal law, if you take any of these actions in this column on the far left, recruiting, harboring, transporting, providing, or obtaining someone by means of force, fraud, or coercion. In other words, by means of violence, by means of lies or deception, or by means of threats. And they can be threats against the person themselves, or potentially threats against their friends, loved ones, or others. and it's for the purpose of either commercial sexual exploitation or forced labor. That is human trafficking. So there's two main types then. You see commercial sexual exploitation would be sex trafficking, and forced labor would be labor trafficking. There's technically a third type as well, that deals with minors, because as you can see from this middle column, you don't have fraud or coercion when it comes to commercial sexual exploitation for minors. The US government has decided, the international community has decided for the last 20 years that minors cannot consent to commercial sex. So any minor who is being engaged in commercial sex is automatically a victim of human trafficking. You don't have to show that they cannot consent. So you don't have to show force, fraud, or coercion. Labels are important. I think it's really key that we be careful with our language. And you hear this a lot in the news, that we're getting better, but there's still some really bad usage in the media, and much less by individuals. Globally, this is a really big crime, a really big issue. The best estimates we have from the International Labor Organization is that there are around 40 million victims of human trafficking in the world today. That includes victims of forced marriage. A lot of us think of when we think of human trafficking, especially here in the US, we think sex trafficking first, because that's been the priority of the US federal response and a lot of state responses. And it's been the focus, I think, for a lot of folks because of their moral or ethical underpinnings. That they see sex trafficking as being the worst. But actually, globally, about 62% of all victims of human trafficking are in a forced labor situation. 38% are in a sex trafficking situation, and about 10% are being forced to work by their own governments. For example, forced prison labor in a lot of countries. North Korea is probably the most egregious offender in this case. Most victims, and this is victims of both sex and labor trafficking, most victims are female. Overwhelmingly, victims of sex trafficking are female, but a clear majority of victims of labor trafficking are also female. And about a quarter of all victims globally are children, with direct revenue from trafficking globally is about $150 billion a year as of a couple of years ago. Looking at the US, we've never had a national prevalence study within the US, but we have some pretty good estimates that come from an organization called the Global Slavery Index. And the best estimate we have is there's about 400,000 victims of trafficking in the US. That is a conservative estimate. A few years ago, for example, the University of Texas did a study looking at just the state of Texas alone, and they estimated there were over 300,000 victims just within the state. We think about a quarter of those victims are children who are victims of commercial sexual exploitation. Within the US, we think it's about 50-50 sex and labor trafficking, with a big chunk of that being mixed in some form, both sex. And then if a minor is sex trafficked, so it's when someone is first sex trafficked as a minor, the average age that takes place is around 12 or 13 years old. There's been several national looks that have shown that, national studies, and then we've done our own work here in the state of Ohio that confirmed those numbers. Around 13 years old is the average if someone is first sex trafficked as a minor. The National Human Trafficking Hotline collects data every year. These are the data from last year. These are the top 25 types of calls or sources of calls that were confirmed victims or confirmed cases, either calls from victims of trafficking or confirmed tips about confirmed trafficking cases. As you can see, the number one source of calls is escort services. Number two are illicit massage businesses, solicitation, so outdoor prostitution, residential prostitution. But then number five is a labor trafficking situation, forced domestic servitude, with someone forced to work in a home, a nanny, housekeeper, au pair, forced to work in a home. And you can look through these and you can see in the US, there's a wide range of occupations that are at risk and of human trafficking. Think of what's going on as a continuum of exploitation. In the best case, we have good, decent work, but then you can have things start slipping, wages, mandatory overtime, hostility at work, lacking control of your environment, labor, wage and hour violations or labor law violations to human rights violations. And in the most egregious cases, you have human trafficking and slavery. As I said, this is a business. It's a people traffic their fellow human beings and exploit their fellow human beings because they can make a profit from it. It's a business of supply and demand. The supply are the vulnerable people who are exploited or potentially exploited. And of course, the retail side, the demand side drives this whole business as it does every other business. So thinking about that business side of things and then putting it all in perspective, exploitation that can shift until it gets increasingly bad and finally crosses that line of legal definition that shows where it goes to slavery and trafficking. And then putting all of that inside the greater framework of the coronavirus and the COVID-19 pandemic. So I want to look at a few examples and a few cases, just a few slides of this. Think about sex trafficking. If you're being sex trafficked, you're forced to perform or being coerced to perform commercial sex, social distancing is not possible. There have been anecdotal cases from local servicemen, folks who work with, do outreach to victims and to sex workers in the greater Dayton area of customers still forcing providers to engage in kissing, a whole bunch of other really dangerous, unwise, unsafe practices right now. If people are concerned about the coronavirus, but they still want to get their commercial sex, what's happening is there's been more virtual sex work, both in the cases of pornography. The largest provider of porn on the internet, MindGeek, Pornhub, they run Pornhub and a few other websites, as they've given away all their porn for free as a public service during the coronavirus crisis and the pandemic. And they saw just during the month of March and over an 11% increase in porn viewing across their websites. There's also sex chats, telesex, real virtual sex work that takes place in a lot of rooms. So it's not just recorded porn, it's essentially live sex acts that people log into. With the increase in porn and the pornography, there's of course health concerns for the performers. Many of sex workers and performers have been complaining about this, and there's a probable increase because of this in the amount of coerced performers and trafficking victims. Some other anecdotal evidence, this was coming out of New York, some advocates in New York were seeing, since the demand for commercial sex decreased so dramatically, the traffickers were still wanting to make a profit from the exploitation of their trafficking victims. So they literally transitioned them into the gig economy, DoorDash, Instacart, et cetera. And so and of course the traffickers are getting the money from these jobs that their victims were doing. Additionally, you're seeing people being transitioned into other forms of low-level criminal activities, such as being drug couriers, because the illicit drug trade and addiction still continue in spite of the pandemic. Thinking about on the forced labor side of things, think about forced labor and supply chains, which we talked about a little bit earlier as well. With the economic disruptions caused by the pandemic, there's been an increased worries and increased focus on the bottom line, on just what do things cost. And this has led to a decreased diligence by firms and even by consumers in looking at where their products come from. If you really need some PPE, some personal protective equipment, are you checking the supply chain and seeing where it's sourced? Or do you really care if it was being made by forced prison labor in China? So the price gets prioritized over other social or environmental concerns, even by normally conscientious consumers and firms. And then exploited workers that are, even in the best of times, have problems with workplace health and safety and OSHA regulations, as Carolyn mentioned earlier. But now, one great case or example is looking at farm workers, and the CIW, the Coalition of Immokalee Workers, has been doing a great campaign about farm workers in Southern Florida. There was a great opinion piece in the New York Times recently, and I think it came down basically, this is a great quote, the message to our country's farm workers is unmistakable. While your labor is essential, you are expendable. That is wrong, both morally and for our nation's food security. Thinking more generally, people have vulnerabilities that are exploited by traffickers that force them into a human trafficking situation. The pandemic has been increasing the vulnerabilities or risk factors for many folks. There's a lack of shelter and a lack of housing for people. And even if someone needs housing and there are beds available, with the lack of widespread testing, many people who need a shelter are being turned away because the people who are operating the shelters are trying to protect the residents that are already in the shelter, and they don't want to spread the virus. Jamie just talked a few minutes ago about the domestic violence and abuse and dangers of staying at home. If you don't have a safe home, maybe the idea of running away, of going to a trafficker is more likely. And for some folks, for some victims, the trafficker's home is their home. There are a lot of things that push people into trafficking that are related to the pandemic as well. Think about the economic insecurity, poverty, vulnerability, homelessness. Think of how all of these factors and stress can lead to recidivism or reoffending by folks or a return to their trafficker. There are a lot of vulnerabilities and risk factors associated. These were some that the U.S. Department of Education put out specifically for child victims. And some of these, it's very clear to see how the coronavirus pandemic is exacerbating these risk factors: lack of personal safety, isolation, emotional distress, poverty, homelessness, family dysfunction. All of these are risk factors that are being made worse by the pandemic and will be potentially leading to an increase in trafficking victimization. To wrap things up, if you see trafficking or think something's taking place, if you see something, call someone, make the call. This is considered, if it's a protected category, this is a form of abuse that must be reported. For example, a child, this is a form of child abuse, so it has to be reported if you're a mandated reporter. Follow those guidelines. Contact your local police. If you're here in the greater Dayton area, you can call the Montgomery County Sheriff's Hotline. And if you just Google that, Montgomery County Montgomery County Human Trafficking Hotline, it should pop up. Or you can always call the national hotline, the 888-373-7888 number. And they'll get the data, they'll connect you to services, and it'll bounce back to local experts in the area that the trafficking is taking place. Educate yourself more, spread the word. If you're a student, write a paper or give a speech about trafficking to spread awareness. If you're an instructor, add a book or a reading or some aspect about trafficking in one of your classes. Get involved and thinking about, be a conscious consumer still. Buy used, buy fair trade, shop your values if you want to do something about this. Thank you very much.
Thanks, Tony. That's great. Those of you who are listening, we'd love to have you join in now with some questions for Tony about his presentation, about trafficking, about advocacy from the Human Rights Center in this area. Please, if you are interested in getting a question in, send a message to Shelley Ingalls in the chat, and we'll be happy to unmute you and bring you into the conversation. Okay, we have a question from Chris Ferree. If you give me just a second, Chris, I will unmute you.
Hi, great speech, Tony. I just want to know, how did you kind of start to get interested in this topic, and because when you were talking, you brought up something about China and how like we don't really think about where our products come from. When did you kind of realize that this was an issue, or what made you begin to have an interest in this issue?
Sure, Chris, thanks. This sounds really pretentious, but I have a TED talk about that you can check that out. And it talks really about the origin of how I learned about this and became really aware of it. But in brief, I was in the military and I traveled a lot in Asia, Southeast Asia, East Asia, South Asia, Africa, et cetera. And I saw a lot of really terrible things and a lot of exploitation and abuse. I didn't quite understand it. I went back to school. I learned a lot more and started realizing that we needed to do something about it. I started teaching these issues, especially children's rights issues, things like child soldiery, child sex trafficking, child labor. And I taught it from a global perspective. And I'm a little embarrassed, but I did that for probably 10 years. And it wasn't until 2009 or so that I started really thinking or realizing that these same issues I was teaching all my students about globally were also happening locally. And when that happened, I got together with some community members, some other faculty and staff members here at the university, and we started doing a lot of work and working with our students here at UD. I think the students at UD really led the way. There were concerned students that back in 2009 that founded the New Abolitionist Movement, which was the first local anti-trafficking advocacy movement in the area. We followed real quickly with founding Abolition Ohio and have been working with students and community members ever since. So I think I saw a lot of things firsthand, and it took me a while to put two and two together to realize that it was happening here and my own actions were complicit. I mean, we're all guilty of this. None of us are completely slave-free or fair trade, but I think it's something we need to strive towards. Thank you.
Tiffany Hunsinger has a question. Tiffany, would you like to ask?
Sure. Yeah, my question is just, you've mentioned something about like starting a book club or giving students readings. Are there any specific ones you'd suggest right off the top of your head?
Sure, especially if you're, it depends on the age that you're talking about. Are you talking about younger students or college age?
I'm talking about college age, probably.
Okay. There's Kevin Bales is one of my favorite authors and scholars on this. It's Bales, B-A-L-E-S. Mm-hmm. He's a sociologist. He's written extensively, got a lot of books that are very accessible, but still academically rigorous and advocacy focused on trafficking. The Slave Next Door is really good about looking at human trafficking in the United States. We have a lot of these resources on Abolition Ohio's website, which is just abolitionohio.org. If you want to know more about especially U.S. domestic commercial sex trafficking, especially child sex trafficking, Teresa Flores, who is actually a UD alum, is a survivor of domestic minor sex trafficking herself. She lives in the Columbus area, and she's an award-winning author and advocate as well. So she has a great book. It's really similar to the other book in title. It's called The Slave Across the Street. Bale's book is The Slave Next Door. This is The Slave Across the Street. and it's a narrative nonfiction account of her experience. She was first trafficked when she was 15, and then what happened to her experience and what's gone from there. And I'd be very happy if you reach out to refer a lot of, there's many other books to go, but those are two very easy, accessible, and informative books to start with.
Perfect. Thank you.
You're welcome.
Thanks. If anybody else has a question, let us know quickly. Otherwise, we're about at time to take another quick break. Okay, hearing no quick replies, I'm going to say thank you, Tony, for bringing your expertise to help us think more about what may be going on in places that we're not aware of, things that we're not seeing, to keep us tuned in, especially in this moment, to the concerns related to human trafficking. So thank you.
Thanks.
We're going to take a short break again now, and next up will be Brother Ray Fitz, who is the professor of social change and president emeritus at UD. We'll be talking about poverty in the city of Dayton, especially. So we'll be back here at 5 o'clock to start that. Thank you.
Okay.
Okay.
And am I supposed to hit that, or I mean, if
No, you.
Now, if you're ready.
ready to go?
Back for the fifth part of our teach-in today on COVID-19 and the common good. Brother Ray Fitz, who is the University Professor of Social Change and the President Emeritus of UD, has many years of experience as an advocate and activist and teacher about poverty, especially urban poverty in the city of Dayton. So we're grateful to have him join us today.
Well, thank you, Kelly, and thanks, Shelley, also for organizing this. When I saw what Kelly had me down for, it was impact on communities of poverty. The thing that came to me is, as I've been thinking about this, is that the trends that we see in the rate of infection and death from the coronavirus is really a manifestation of what I call the social injustice of the organization of our metropolitan region. So I'm going to some things that I've been really concerned about, which is the social justice in our metropolitan region. And it's not just the center cities that I'm concerned about. I'm concerned about the whole metropolitan region, because I believe we can't solve the center city issues without the whole region becoming involved. When I work with my students, there are two images that I use. One is the metropolitan region as a fractured city. I always say to the students, where do you go to do your shopping? Where do you go for entertainment? And, most people, if they answer those questions, will say, well, I go to the mall sometimes. I go downtown to the Schuster Center. I live in a neighborhood, but my city is really the whole metropolitan region. And so once I get people to believe that and see that, I begin to ask them about what is the organization. And I will show you in a few slides here that I really believe our metropolitan regions, not just the greater Dayton metropolitan region, but almost every one I've looked at across the country is a fractured city. And then one of the things that I try to get across to students is, because we have these high poverty neighborhoods, or what I call low opportunity neighborhoods, there's a silent violence of poverty. And what I mean by that term is that it's silent because most people aren't aware of it or don't think about it in our community. It's violent because it's actually reshaping the brains of our children. It's causing lots of concerns, particularly among women and trying to raise families in these situations. And so try to bring those two issues together. And then I think that as I listen to the other speakers, Vince talking about neoliberalism, I really saw a lot of good connections. One is, how did our regions get organized the way they are? And I do think tacitly neoliberalism, or thinking about myself and my choices, is important. I thought Carolyn's work on workers, and particularly, I think people in low opportunity neighborhoods have been really impacted on this worker issue. And I think we've seen it. And then Jamie's work, I've been doing a lot of work on domestic violence. And I think it's, again, these issues of poverty are important. And then Tony got me thinking about what is the role of sex trafficking in the organization of a metropolitan region. So it's been a very helpful process for me. So what I'd like to do is start off with just some statistics about the impact of the coronavirus, particularly on the African American community and the Hispanic community. So it's people of color. And I think as we get the data clearer on this, we'll see that it's really not only the people of color, but it's people in poverty that make up. So one of the things that we know is we don't have very good data on tracking what's happening with this virus. Some health districts are pretty good, but nationally we don't have uniform data. And particularly here in the city of Dayton and the the metropolitan area, we don't have data that relates infections and deaths to social economic status. And so I think once that becomes a little bit more evident, it'll show how this is all related to poverty. In New York City, Hispanics make up 34% of the people who have died from the coronavirus, but Hispanics are only 29% of the population. For Blacks, they make up 28% of the people who have died, but Blacks are only 22% of the population. So whites make up 27% of those who've died, but they're only 32%, or they are 32% of the population. And again, Asians make up 7% of the people who've died, but the Asians are 14% of the population of New York City. So you can see right there an imbalance of people of color in this pandemic. Chicago, which has been another hot spot, is that Blacks are 30% of the population, but 52% of the people that have been infected and 72% of the people that have died from the coronavirus. And on a statewide level in Illinois, Blacks are 14% of the population, but they're 29% of those that have been infected and 41% of the deaths. And you see a similar pattern in, for example, Milwaukee, where Blacks are 30% of the population, but Blacks have been 50% of those infected and 81% of those that have died. So you can see the same patterns in Michigan, with Detroit being a hot spot, and Louisiana, with New Orleans being a hot spot. So again, I think one of the outcomes of this pandemic will be the asking of us to do a better job with collecting of our health data so that we can understand the underlying factors that are part of the pandemic. Quickly, a kind of an analysis that I use is what I call the two neighborhood method of analysis of regional areas. It's pretty simple to, the way I do it is that I take a look at regional areas and I say that there's a spectrum of neighborhoods. On one end, there are what I call highly affluent neighborhoods with high opportunity for the children and families. So these would be neighborhoods that are less than 5% poverty. And at the other end of the spectrum, we have distressed or low opportunity neighborhoods where poverty is greater than 40%. So those are the two ends of the spectrum. And by looking at those, we can begin to see an opportunity gap. And that's where the opportunity gap between these neighborhoods is the way I've been looking at this issue of injustice in our regional areas. So I think that one of my contentions as a practitioner, less as a scholarly person, is that I think the underlying conditions of poverty are really impacting the growth of this pandemic and its manifestations. I do think if we come out of this, we really have to do a transformation of how we look at our organizations of our metropolitan regions. If we don't become more just in our organization, I think we're going to lose a very critical opportunity. So now if I can, I'm going to just kind of show some of these trends. So this isn't as nice as I would like it, but let me go with that. So the first thing I want to do is just to look at what I call the patterns of high, middle, and low income neighborhoods in Dayton, in the Dayton metropolitan region. And you can see the blue colorings are people that are above the regional family income, and those that are in the orange and red are those that are 100% or below the median family income. And this is a trend that you can see in almost every major metropolitan area. And what, you know, the old song that people have been saying, the rich are getting richer and the poor are getting poorer, and we're kind of losing the middle class. I mean, it's not as dramatic here and the Dayton metropolitan region as it is in some other areas. But again, this trend from 1980 to the 2010, I think is something that says something about the organization of our metropolitan region. And again, if this slide kind of shows how, what would I say, the whole concept of how we've dispersed with poverty going into the center city and expanding, and regional areas like in Greene County and parts of Warren County are really growing much more affluent. So the trend again is to see this urban flight that's really amplified these problems of poverty. This is, colors are different here, but I just thought this is interesting. I keep talking about the fractured city. This is out of the New York Times, looked at the election patterns that were there, and you can see the Democrats are in the center city, African American. The more affluent areas are the Republican voting patterns. The most disturbing thing for me is this graph right here. It's, if we look, sorry about that. If we look at, and particularly what I'm concerned about is the African American population, only about 18% of African Americans are in that higher bracket of, from the median income and above, and over 80% are in the lower categories. And again, it shows a tremendous, in the whole metropolitan region, it shows a whole, what would I say, a difference there. If we go just to look at the neighborhoods again, the high opportunity neighborhoods are mostly white, low poverty, low opportunity neighborhoods are mixed, African American and Hispanic. If we look at the family structure in that process, we see that the high opportunity neighborhoods have a high percentage of married families, where single parent families dominate the low opportunity neighborhoods. Again, being concerned about children, this is the one that really looks at our city of Dayton and the increase of children in poverty over this period of time from 1990, the 2000 census, to the 2015 census. Again, the difference in housing, 94% occupant housing were compared to 70. At the bottom here, I think is the most important one. The national figures is that if you, to cover all your expenses, you should only be paying about 30% of your income for housing. You can see in the low poverty, the low opportunity neighborhoods, there's a much higher percentage of that, and that means other things of life get shortchanged. Here's the thing that disturbs me the most is in our high poverty, high opportunity neighborhoods, we see pretty good scores on kindergarten readiness, reading proficiency in third grade. And you can see those things are increasing over time. So the deficiencies are moved away. In low opportunity neighborhoods, we see very low scores on the things that we rate our school system on. And to me, I think coming out of this pandemic with a lot of home working, these scores are going to be much worse next year for people in low opportunity neighborhoods. Again, this graphic just shows what's the impact on children, and these have families and schools, schooling, differentiation, the community, less recreational areas, and parenting. So I'm going to go, and it looks like from Lori, I'm getting to the end of my time here. So let me, there's two emerging initiatives on regional justice that I think are very important. And I would like to say something about those. First is what I call the two-generation approach to looking at the issues of poverty. We have just begun in the Montgomery County a coalition for two-generation approach, which says that we want to treat the family as a unit. We want to make sure children have good education, out-of-school programs, good home visiting activities. At the same time, we want to work with the parents to give them the skills that they need to help their children with literacy, building family communication, and strong workforce readiness. And so moving people from jobs that pay much better and that offer opportunities for advancement. And so what we've been trying to do is to connect the children and the family as a unit. And we've been working in at least two places, a couple others, but two is one, East End Community Services on the east side of Dayton has been using this model. And the Omega CDC on West Dayton is building a Hope Center for families that will be doing this two-generation approach. One of the things that I think is important is that the University of Dayton can really take a leadership role and continue to develop this. I think the whole notion of the educational pathways, how do we move children from kindergarten readiness to a credential that allows them to be part of the workforce? But to do that, we need to build family supports to help parents understand literacy and also to how to do things well in the family, communication-wise, dealing with conflict. We need to do workforce development in terms of how do we move parents and children, mothers and fathers into livable wage working areas. Economic development, School of Business is just starting an enterprise part of their work to work in minority communities. The place development is how do we convert vacant lots into green spaces and to help, help develop the aesthetics of a neighborhood. And then the whole concept of a community leadership program. And so I think what I've been working with is this concept of an integrated neighborhood development process, where I think there are different parts of the university that can really contribute to making that happen. A second initiative that just got started, and again, this came out of a group that we have at the Dayton Foundation for, equity in our community, and this is the Miami Valley Regional Planning Commission. If you go to their website, you're going to see the work that they have on an equity initiative, and I keep spelling initiative wrong there, but we can go past that. Some of the principles that are guiding it is that we need to invest in all the people in the communities. We need to address how policies and investments have an impact on inequity and to provide tools for changing. Again, the definition that's been emerging in our community around equity means that all purpose, regardless of where they live, so what neighborhood they're in, have access to resources and opportunities that improve the quality of life and helping them to realize full potential. And again, I think this is a shift away from, we're going to deal with the poverty issue. How do we create conditions in our metropolitan region that allows everyone to have the resources and opportunities to improve their quality of life and to reach their full potential? And again, the emphasis on we really must begin to invest in places and people that have been left behind by the economic work that goes on. So now let's see if I can get us back to okay, we're back. So my conclusion is basically that if you look at all the issues that are involved with the pandemic, and I skipped over some of those just to be we know that the whole problem or the issue that we see is that these low opportunity neighborhoods, they have a deficiency in education, they have deficiencies in healthcare. The kind of jobs that are available to people in these neighborhoods do not allow them to have a decent living. And the other thing we know about the health conditions of our low opportunity neighborhoods is that they don't have good health services. The cost of medicine and opportunities to take on preventative medicine are very low in these neighborhoods. And again, as Carolyn pointed out in her presentation, people that are in the low opportunity neighborhoods are in these essential services, but their housing conditions are such that if they go home at night, they're going to be in a very difficult situation of having social isolation. So again, I just wanted to emphasize that I think the way we've organized our metropolitan regions makes us very susceptible to a health crisis like the pandemic. It would be great if we could see the opportunity of transforming so that people in the low opportunity neighborhoods can have an increase in opportunities for their own life and realize their own full potential. So let me stop there and I'll take some questions.
Thanks, Brother Ray. I appreciate that. If you do have questions, please let us know. We'll be happy to unmute you so that you can join the conversation. I'm gonna start, Brother Ray, with a question, if you'll let me. I've heard a lot of talk here in Dayton, and I'm sure that this happens in other places as well, that of people speaking very highly of Dayton as a community that has endured a lot of difficulties and has worked together to address them. And I wonder if you would say something about some of the policies, structures, institutions in Dayton that you think are helping us to address the common good in this crisis, or are particularly not helping us beyond the kind of historical inequity, the fracturing that you were talking about before, particular kinds of things that happen in the city that could help us promote the common good.
The way I would go at that, and I think there's two concerns I have. When I was working on the Oregon District Fund, and the reason we were able to raise money for that fund for the people that were injured through that activity was people saw that as kind of what I would call an act of God. Something happened that was not somebody's responsibility, right? So we feel bad for this, the same way we did with tornadoes. We come up and we're able to do things. But one of the reasons, and it goes back to Vince's presentation on neoliberalism, or how I'm more concerned about myself, the reason we don't take on this issue of poverty as a regional issue is because there's an ideology out there that says people are poor because they don't take the effort to get themselves out of that. They don't have a sense, people in the community don't have a sense of the structural injustices that people deal with. And that's why I think it's very hard to mobilize for poverty, where it's much easier to mobilize for the Oregon shooting or the tornado issue, because again, this is ideology about how we see poor people in our community. I don't know if that's getting at your question directly, but that's been my experience.
Mm-hmm. Yeah, I was wondering if you have ideas about how policies in the city or approaches in the city that have been more or less helpful in addressing that kind of problem.
So one of the things that Dayton has, I should say Montgomery County has done really well is the Human Services Levy, where there's, it's a tax, a property tax that is used to help deal with the human service issues we have in our community. And again, if you're a more affluent neighborhood, you have a higher value housing, you're going to be taxed higher for that. So I think it's a progressive, thoughtful taxing mechanism to get money into human services. It's always a hard push. I've been on that campaign 3 times, and we've been able to get the human services levy passed. So I think that's a good thing. I believe this initiative of the Miami Valley Regional Planning Commission, which brings together multiple counties, Greene County and Miami County and Preble County and Montgomery County. I think we can begin to look at the issue. It's going to take a lot of time. And then I also believe that Montgomery County commissioners have accepted this coalition on the 2-generation approach to reducing poverty is just in its beginning stages, and I think it has lots of potential for aligning services in the community around families and children.
Thanks. Do we have another question? There we are. I think Shelley was going to ask.
Yeah, Brother Ray, those sound like great initiatives. In light of the pandemic, though, and the virus, and some voices saying we need to adjust and we're going to need to go through various phases of this kind of social distancing. Are you seeing the policy mechanisms that have been established and the approaches able to respond to the new dynamics and circumstances that we have, and able to, in real time, be integrating some of the challenges of the virus into their collaboration and coordination and thoughts on policymaking moving forward?
I think that's a very good guiding question for the future. I would have to say that, the number of meetings that we've been working on this got disrupted like everything else, right? So our meetings are now on Zoom, and it's very hard for us to begin to think about how we align resources. But one of the mechanisms that we're coming up with is how we give out discretionary money from United Way and from the Human Services Levy. At least we're making enough progress to say that we have to come together with a better understanding of justice in the region. I'm not sure every public policy person would say that, but how do we deal with these discrepancies that we have in our community? And I think funding mechanisms are going to ask the people that work at these issues to align their resources. How do we align programs? So if you're working with children, we're going to ask, can you can you collaborate with someone that's working with families, such that we're treating not only the children but the families in a particular place? But Shelley, at least my experience is that this pandemic has shocked the public policy making process in our community, just as much as it's disrupted the university and everything else in the community. So I'm hoping as we come out of this process that we can pay more attention to what were the underlying causes of the pandemic, and how do we sort out the human rights and justice issues that are contained there. But it's going to be a slow process. I don't see any magic bullet.
Thanks.
So thank you, Brother Ray, for this presentation, for bringing your expertise about this region to these questions. We're going to pause here just very briefly to change over. Our last speaker for today is Marie Vivero, who is an associate professor in finance in UD's School of Business. So we'll be back with Maria in just a minute. COVID-19 and the Common Good teach-in at the University of Dayton. And our last presentation today is by Maria Vivero, who is a professor in the Department of Finance at the University of Dayton. We're very pleased to have Dr. Vivero here, especially because we started with a sort of a big theoretical view of neoliberalism, and then we've sort of zoomed in closer to the experience from the perspective of a number of workers, from people living in poverty. And now we can end by sort of zooming back out again to look from the perspective of the discipline of finance. So Dr. Vivero, over to you.
All right, well, thank you so much, Kelly, for the invitation, and very happy to be here. Today, I am going to talk a little bit about inequality, wealth and income inequality, and how inequality interacts with the current situation we're dealing with the COVID pandemic, but also in light of other pandemics that have happened throughout history. So I want to speak with you from my discipline. So I'm a professor at the School of Business. I teach finance courses. I'm an economist as well. And I understand the world from the point of view of business and economics. So I understand that most of the presentations have been from the point of view of social justice, but in reality, the pragmatic approach of business administration does not conflict with what has been stated here. It may be that we can cast light in some different way, but in the end, we can come up with a very clear and consistent conclusion with what we have heard through history, department and social justice, and Brother Ray. So actually, some of the first pictures I want to show you kind of overlap or expand what Brother Ray was showing us. So I want to first describe a little bit the current situation. So I got this information from Johns Hopkins University, and this is the current situation on the COVID epidemic as of today. This is the world. And at the moment, we have 2,214,861 positive cases for the coronavirus, and the US is leading the pack. Currently in our country, we have 683,786 confirmed cases. And we have more deaths in the US than anywhere else in the world. In fact, today I heard that about 1 of every 5 deaths worldwide are coming from the United States. So the virus is hitting us pretty hard, and also the mortality rate is hard in the US. So from the closed cases in the US, about 37% of them have finished with the death of the patient. And that is far higher than in the rest of the world, where for the closed case, 21% of the closed cases have finished with death. So that means that this is an issue that is affecting us more heavily than probably even other countries in the world, other countries with fewer resources. And there's a flag for concern for why would that be. Let me show you some information about our state and also our county. So for Ohio, even though we are the 7th largest state in terms of population, when it comes to number of patients, we are actually number 17. And it could be because of the early action that the state of Ohio took. So we were able to avoid being being number 7 when it comes to number of patients. That would have been, our curse if we would have followed similar approaches to other states. But given that Ohio was very early to take preventive measures, looks like we have been spared for many of the worst part of the virus in our country. So here in Ohio, currently we have 9,107 cases, and we have 2,424 people in the hospital. 418 people have died, and I think as of today, we had a little over 700 people in the intensive care unit. So we are below capacity and very grateful for that. And then for our county, Montgomery County, we currently have 222 cases, and we have lost 8 people in our county. So that's the situation. When it comes to the curve that everybody talks about, and if you were to just look at the evolution of the number of cases for our state, we seem to be getting close to the top of the curve, because this is the shape that it usually takes. So probably over in the next week or so, we're probably going to start to see a reduction in the number of cases, which would be very good. And the mathematical projections state predicts that this is going to be the case. All right, so now this is what's happening right now with the pandemic, and I would like to interact the current situation with what's happening with economic inequality in the United States. I got some information from the Pew Research Center, some facts, so you can get an idea of how unequal is the US economy. And this has not always been the case, but is a trend that has been observed since the 1960s, and it's become deeper. So here's some things that are important about US inequality, just to keep an eye on how big this is, how big of a trend it is. So just to give you an idea, over the past 50 years, since 1968, the highest earning 20% of US households have steadily brought in a larger share of the country's total income. So the highest 20% of the US households used to bring in about 43% of the income in the US. And the top 5%, 16%. Now, the highest 20% brings in more than half of all the income in the US, 52%, while the top 5% of households, they earn 23% of all the wealth, of all the income in the country. And you can also see that the share that the lowest 20% is receiving from the global income has become lower as well. Now, how does this inequality compare against other developed countries? That's something else that many political scientists talk about. Turns out that if you were to look at the Gini coefficient, which is an index, is a number that would take a value of 0 if a country or a society were completely equal, in the hypothetical case that we all would make exactly the same money, and 1 would be a society that would be entirely unequal, where you would have one person that pretty much dominates all of the economy and everyone else would have nothing. The US has a Gini coefficient of 0.434 as of 2018. And for all the other developed countries that are similar to the US, UK, Italy, Japan, Canada, Germany, France, we are leading the pack when it comes to inequality. Other countries, developed countries like the UK, they have a Gini coefficient of 0.39, Italy is 0.37, Japan 0.36, Canada 0.35, Germany 0.35, France 0.32. So we are getting close to our inequality levels to some African countries. And that is very worrisome because it shows that as a developed nation, we are looking very different from everyone else. Let's see, here's another statistic that you might find interesting. The wealth gap between the richest and the poorest families more than doubled between 1989 and 2016. So in 1989, the richest 5% of families had 114 times as much wealth as the families in the second quintile, so the lowest 20%. By 2016, the top 5% held 248 times as much wealth as the median household. So, if you take the median household, the 50 percentile, and that would be middle class, the top 5% is 248 times wealthier than the median household in the US. So it gives you an idea that there's families that, as much as they try, they're never gonna make it, because the society, the playing field is now so slanted. There's no way they will never be able to get out of the situation they're in. There's an article from the New York Times that I have shown to my students several times that talks about how expensive it is to be poor. And turns out that being poor is extremely expensive, and it's very difficult to get out of poverty because the cost of their situation keeps them in that same spot. For example, if you don't have health insurance, the only times that you go to seek medical help is going through the emergency room. And if you go to the emergency room and you don't have insurance, just the ride for the trip to the hospital would cost you in the ambulance about $500 just for the trip. If you don't have credit and you need an overdraft to be able to pay for a new set of tires, the overdraft fee from a bank is around, I believe, is around $20 for 10 days. And if you annualize that rate, ends up being around 2,000% effective annual rate, when someone that has a credit card is able to borrow that same money for a rate of 17%. So the structure of the economy is making these inequalities pervasive. And this is something that's been happening over a long time, over many decades, and that has created some big distortions in our society. Here's the last picture about inequality. You can see here in this chart how the middle class has pretty much, it has shrunk so much that now 62% of the households used to be middle income in 1970. While now in 2018, or 2 years ago, 43% of the households could be considered middle income. While the lower income households remain about the same, upper income has gone from 29% of the aggregate income, the share of the aggregate income, and now the upper income households, they have 48% of the aggregate income. So, so the middle income is gotten much smaller. They share a lot less of the U.S. income, and what we have now is a big divide between the very wealthy and the poor, and what's in the middle, that used to be this very strong middle class that was the backbone of the U.S. economy, is getting smaller and weaker, and that affects everyone. So why is this a problem? Why is inequality a problem? It's a problem for everyone. It's a problem for the US economy, and it's a problem that affects the wealthy just as much as the poor. Even though not every group would realize it, it's actually a problem that affects all of society and the entire economy, and needs to be addressed at some point if we want to continue being a developed nation. So here's just some aspects of, or some reasons why inequality should be something that we all should be worried about. And of course, as Catholic Marianist University, we care about inequality because we seek the common good and social justice. But even if that was not the case, we would still care about inequality because it affects everyone. For example, inequality limits educational opportunities for children from poor backgrounds. And that limits social mobility, so the possibility of people moving upwards in the social scale from lower class to middle class to upper class. And the problem with this is that it makes the labor force less competitive against other countries. So if we want to continue growing, we need to have a labor force that is competitive and that is well educated. And having lower opportunities for some groups makes it hard for all of us to have a well-trained, well-developed workforce and healthy. It also, inequality also depresses economic growth because because when wages are low, because of low educational attainment, with low wages, we have lower income, and also we have lower aggregate demand. So the opportunity to sell our products to our own customers and to our own middle class gets smaller. So when we have big inequality, it's very difficult to sell our products to our own employees, for example. So there's this story about Henry Ford and how Henry Ford created the Model T car with an offer that for a fairly low price to his own employees. But it wasn't because he loves his employees so much necessarily, but because he wanted to have enough demand for his own products. So if you don't have a well-paid workforce, it's very difficult to be able to grow the domestic demand. Also, with inequality comes criminal behavior. And with increased criminal behavior, we have very steep costs for society. The costs of policing and incarceration become very high. And whenever we are using all these resources to solve or address these problems, including addictions and other problems, that leaves less resources for other needs like health and education, infrastructure, which we know is in big need for repair, research and development, and continuing to progress as a nation. So inequality really doesn't affect us only the poor. That would be the obvious thing, right? Because they are the most hurt by the situation. But it affects everyone. Over the long term, it affects the entire country and the entire economy. So this is why it needs to be addressed, even if we were not in the the Catholic Marianist tradition as we are. How is inequality making the current situation worse? We see that the coronavirus crisis is hitting the US especially hard. And some of the reasons could be because of the deep inequalities in our society. First, we have unequal access to healthcare, which is making addressing the situation harder than in countries that have equal access to healthcare. If you don't have a referral from an attending physician, you cannot get tested in the state of Ohio. I know because I tried, because I was having a little cough and I called, and the first thing that they said is that I needed to call my doctor. And then the doctor would give you a referral to get testing. So if you don't have an attending physician, if you don't have insurance, then you're going to be able to get tested. You're not going to be able to get treatment. In addition, people that do not have access to healthcare also have other pre-existing conditions that seem to exacerbate the effects of coronavirus. And in lower income households, there's a higher likelihood of dying from COVID-19 than if individuals were healthy, because you have other conditions that contribute to making this virus more aggressive, like high blood pressure, obesity, diabetes, heart disease, problems with liver failure because of alcohol consumption and drugs. So all these conditions seem to be more pervasive in poor households. And also when you have unequal access to education, it's more difficult for people to understand the importance of sanitation and social distancing. So with that also, you have a problem, because not everybody is able to understand the science behind the pandemic and how diseases spread as easily. And then finally, we have financial fragility of households. So right before the pandemic, the statistic was that about half of US households were not able to afford they would not be able to afford a $400 emergency, because they didn't have $400 in their checking account. They're living paycheck to paycheck. So with that, it's very difficult that some families would be able to stay in place, stay at home, not leave, even if they had to, if they wanted to, or even if one of the family members are sick. That makes it harder to contain the spread of the disease, because there's people that just have no choice but to go out to work, even if they are sick, or even if they're starting to have symptoms. So all these, so this is all part of the inequality of society that's making the effects or containing the spread of the virus much harder. And there's also, there's a two-way relation, there's dual causality here, because the inequality is making the crisis worse, but the crisis, once this over the medium and long term, is going to make inequality worse, unless we do something about it. Because the inequality, like Brother Ray explained, is affecting poorer people harder than wealthier people, because so much of it is dependent on social distancing. So given that we have the need to stay apart, and the need to work from home, and the need to keep all surfaces clean, it's harder for there's a social divide on how we approach the pandemic. So it's hitting harder the poorest people. And there's an unequal effect on Blacks and Hispanics, who are feeling these the effects of the virus even harder. So if we don't do something, we're gonna see that after this pandemic, we are going to have a more unequal society than now. So we can let it take its course, or we can do something, and we can see this as an opportunity to mitigate inequality. And why I think that this might be an opportunity to reduce the inequalities that are so ingrained in society and that have been brewing for several decades now. Well, first, because if you look at history, there's two events that have had the biggest effect on wealth inequality. And those have been wars, mostly revolutions, and pandemics. So with pandemics, in other times in history, there has been large amounts of population have died. Let's hope that that's not the case this time around. And that has created opportunities to level the playing field between social classes. For example, during the bubonic plague, right after the bubonic plague, that took about half of lives in Europe, the workforce was so diminished that the workers that were left, those that survived, had more opportunity to negotiate rights from their feudal lords during those times. So it's easier for societies to negotiate new social contracts after pandemics because the populations change their orders. Also, if we don't go that far, but we go to the most recent pandemic, the Spanish flu of 1918, you can see that there were many things that happened that reduced inequality that were the result of the pandemic. For example, the Food and Drug Administration got a big foothold on regulation of the food industry right after the pandemic. And also, women's rights became stronger right after the pandemic because women rights movements during those days not only cared about the right to vote, which is what we hear all the time, but anything that affected their families. And sanitation was a big part of it, trying to prevent the loss of their children. One of the maybe small examples of how the 1918 pandemic changed women's situation is that because it was important not to touch the ground, it was then socially acceptable to heighten the length of the skirts. So up to 1918, women were still wearing long skirts, but then they were on the floor, and if they were to come home, they would be bringing viruses and disease. So to prevent disease, it was okay to shorten the skirts. Many cities in the US used to have a single cup, and everybody would drink water from the same cup. That was a good time to eliminate that practice. And there were many other things that happened during that time that were the result of the pandemic. And some of them reduced inequality because education and sanitation became more important, and also health and safety of children and families. So we could use this pandemic as another opportunity to accelerate social change. And I wanted to bring a quote from Yuval Noah Harari. He wrote a very good article on the on the Financial Times a couple of weeks ago. And he's a very interesting, insightful historian. He wrote a book named Sapiens, which is about the history of the world that probably many of you have read. And what he said in this article is that emergencies can provide opportunities because they accelerate historical processes, so that we can use these emergencies to do experiments have been thrown to teach online, giving us only a week to retool our classes. This could substantially reduce the cost of higher education. And higher education has been something that has kept the lower and the middle class away from increasing their wages. And it has become more and more expensive over time. So this could be a time where we could perhaps massify some of our classes without losing its quality. And we can reach people that might not be able to access higher education otherwise. Also, this might be an opportunity to teach children and adults the skills outside of what's taught in a regular classroom, and especially teach families. And this is something that is not from right now, but I have thought for a really long time that unless we educate entire families, it's very difficult for families and children to escape poverty, because there's not much of a point of going to school and getting some classes if when you go home you're surrounded by an environment of violence, or if you don't have anybody to help you with your homework. So we could address some of these issues if we can educate the entire family, and having this distance learning approach could help us reach those goals. And also with health. So as of now, we are looking at the effects of this pandemic, and these big effects could be an opportunity to push for broad access to basic health care for everyone, and not as a matter of giving a benefit to someone, but as a matter of public health, because not having access to healthcare for everyone, not having universal testing of coronavirus is actually making our economy suffer. So for a matter of economic stability, we might want to provide access to health to everyone.
Maria,
And,
if I may, we need to wrap up because we're a little past time.
Oh, okay, sorry. Well, this is my last slide.
Yeah.
So this is the last thing that I wanted to say, and is that financial markets, which is my area, could have a very important role in this process, because financial markets, when they are transparent, when the rule of law applies, when there's freedom of press, and when there's property rights, and when many people are allowed to be part of the financial sector, can be efficient in a different way than any other social arrangement can be, and it's capital allocation efficiency. Capital allocation efficiency means that the best ideas get the best resources. So with that, thanks so much, Kelly. This is what I wanted to present. And I think that this is actually a time of huge changes, and that if we use them as an opportunity, we might be able to do a lot of good.
Thank you, Maria, for this presentation. I think we would, all of us, love to linger and talk about this and pull together some threads from the whole teach-in today, maybe tying this back into the first presentation we had by Vince Miller. But alas, we are over time, so we will wrap it up here. I encourage all of you to keep an eye out for a message that'll be coming to you, and some announcements that will be coming out through UD Networks about the fourth of our series of teach-ins. A week from today, we will be talking about acts of solidarity, ways that solidarity is being practiced in this very challenging environment. We're inviting not only scholars, but some practitioners and activists to join us to talk about what is actually happening as they attempt to address the common good in this moment. So please join us again next Friday, again from 3 until 6. And in the meantime, stay well, stay tender, stay attentive, and we'll see you back here again soon. Thank you.